afternoon, everyone. I'm Madeline Flanagan, the Vice President of Agent Development for the Big I, and we're back this week with our version of HR questions with Claudia St. the President of Affinity HR, our HR partner, and Jennifer Becker, the Director of Education Programs for the Big I. So welcome, Claudia and Jennifer. There's Claudia.
Hi there.
Hey there. And Jennifer, you with us? We'll see. Oh, there's Jennifer. Hey, Jennifer. Hey.
I'm here.
Okay.
Hello, everyone.
So we have a lot of questions for you today, Claudia. Are you ready to answer a lot of questions?
I am. It's exciting.
Is there anything new out in the HR world that we need to know about that you've heard about in the past week before we begin today?
You know, I just think that a lot of agencies and businesses in general are really trying to juggle this balance between opening up and resuming back to business as usual pre-COVID, and the fact that COVID is still out there. And so I think there's a constant dance right now that that folks are going through in kind of the decision tree that they have to go through in terms of who to open up, how to open up, who comes back to the office. Do they even need to have folks come back to the office? And then the whole gamut around, I have an employee whose daughter has COVID. I have an employee who's recovered from COVID. When can they come back to work? And, you know, all of those, it's just COVID creates a decision tree quagmire. And so those are really those happening in conjunction with opening up business has really been what we're fielding most of all.
Yeah, and I guess you sort of work with a lot of other groups other than insurance groups. So there are all kinds of businesses, and what they're facing is not just insurance agency stuff. Is that correct?
Exactly. Yeah. And many of them were essentially, actually almost all of the organizations, associations that I've worked with in industries have been open as essential businesses. But I think what's kind of unique to the insurance space is because of your CRM system, most agencies have been able to operate and work from home. Whereas the other industries, they've been open, they've been bringing employees to the workplace. So they have already tackled how to structure their workplace for social distancing. They've already kind of had to look at where their workplaces are and how to remediate, you know, how to close down a kitchen. That's a new thing that I think a lot of agencies are now dealing with, that some of our other companies didn't really have to do it because they were already working, for better or worse, on site.
Wow. Yeah, so, well, let's get with our first questions today. So, is an individual with a positive COVID-19 test eligible to receive unemployment compensation?
So really, one's medical diagnosis should not affect their COVID determination. So if they're sick, if they qualify for uninsurance benefits, it would be whether or not they have COVID. Now, I think the question here is related to if somebody is out and cannot work because they have COVID and do not qualify or have exhausted the federal benefit for emergency paid sick leave and don't have any other paid time off available to them, could they qualify for COVID? And of course, yes, or for unemployment. And of course, yes, they could apply. Again, unemployment is a state-by-state basis. And so sometimes a state will have a couple of weeks of waiting period in order to get in. Some states are very liberal with unemployment benefits, such as Massachusetts. We see Florida all over the news right now because they've only accepted about 15 to 20% of claims, and their systems are so antiquated that people have been trying for weeks and weeks to get a claim even submitted and have not been able to. So I think the logistics of actually getting COVID or getting unemployment insurance is kind of a patchwork of opportunity. But if you are unemployed because of an illness and you cannot work during this time, I would definitely file and see what the state says.
That's excellent. That's good to know. You know, I never really thought about the states being so antiquated. I did see on the news that they were looking for COBOL programmers, which about the 1970s.
They're bringing people back from retirement, and and I think a lot of these programs have not been funded. I think they're also relatively political. I think a lot of states, don't want people on unemployment, and so as a result, they haven't made the enrollment process particularly easy. And we haven't really had to deal with it because we've been operating with 3.5% unemployment since, the mid 2000 teens. So
Right.
we've never, and under the best circumstance, no one is prepared. No system is prepared for 25 million unemployed within 1 week or 2 weeks or 3 weeks. There's just they're not prepared for that.
Right. I never really thought about those great numbers because they weren't getting many claims for unemployment in the past.
Yeah.
Never thought about it that way. Yep. How about our next question? Oh, this is a good one. My agency needs to hire, but we're not in the office now due to COVID-19. What's the best way to hire and onboard a new employee remotely?
So this is a piece of a great conversation, which is the smart money knows that there's a lot of great talent out there to be had if you're looking. And so now is a terrific time to be hiring talent. I think another change, going forward is going to be, we now know that folks can work remotely. And so having the technology and having the resources mean maybe you don't have to look in your tiny little town, and maybe you can look for some talent that's just a little bit farther out, and you can do a little bit more remote distance work. And so as a result, the pool of candidates becomes much broader because we don't have to look within 20 miles radius of our offices. So yes, I absolutely think that looking is a great idea. I would go on Indeed, I would post out there, I would use your social media networks. As for onboarding, most of your processes and most of your materials are probably already in document format. So what I would do is exactly as you would plan an onboarding, and we actually have a 4-week new hire development program or plan, and it's basically just a way to structure those first 4 to 6 weeks. And one thing we know is that 22% of turnover happens within the first 45 days. And especially now, if we can't be together to really establish culture and invite and bring people in, we run, I think, a greater risk of having folks not engaged. I don't know, a lot of people are going to be quitting considering the employment situation that we have at this moment. But I would strongly recommend that you structure FaceTime, and I recommend video FaceTime, with all of the folks that they need to learn from. You can go through those tutorials just like you would going through sitting with somebody. There's absolutely no reason. Most of these systems are remote compatible. You can do that training and development as virtually as you can on site. One piece of technology that many folks may want to consider is if the employee is coming on board, you want to make sure that they have the computer, the setup that they need in order to be able to do that training. And you may want to lease or donate or lend to that employee a second screen so that they can have the visual interaction, but also go through the work product and have that conversation.
Yeah, that's a smart idea.
It's not as easy and it's not as fun as on-site and in person. But it is 80% of the way there, and we see no reason why we wouldn't be able to have as robust an onboarding, hiring, interviewing, onboarding process as you would doing it in person.
Yeah, that's a good idea.
Mm-hmm.
So let's see the next question we have for you today. Oh, as an employer, am I allowed to say no to someone who wants to work remotely and has children at home, but yes to a childless person who can work all day without distraction? And we'll give that all day without distraction because we know that there are lots of distractions.
There are lots of distractions. I think there's one myth that we are discovering, and that is that people could be profoundly productive working at home, and they can be productive working at home with or without children. Now, my concern here is we We haven't been explicit about what the issue is. Is the issue that the employer presumes that they will not be as productive because they have a child at home? Do they have any basis for that fact? Have they been able to determine that? Have they tried it to see how productive that employee was? What I will tell you is that if the decision to let somebody work from home, let somebody without children work from home is because there are no children in the home versus not letting somebody work from home because there are children in the home, that really reeks of discrimination. You're discriminating against somebody because of their family status, which is a protected class. So I would definitely make sure that you are making the right decisions on that. I have talked to agencies who say, I had her working from home. She wasn't able to get the work done. She was not as productive. They tried it. She wasn't as productive. Then my point to them is, then if they cannot work from home effectively, you tried it and you cannot provide that kind of accommodation, then they would qualify under the emergency paid family leave for 2/3 of pay, up to $200 a day, for 10 to 12 weeks. So if they can't work from home, then you're probably going to have to pay them to take that time off. My bet and brain says I'd get as much out of them as you can. Do your best.
Right. And I guess you document it as well, right? You would need to document.
Absolutely. And based on what are we determining that productivity, that effectiveness by? Is it you're not available to answer calls? Well, can somebody else handle the calls and somebody else do the back end stuff? Can you divide up your workflows? Maybe they're not how you normally have them, but is there a way to do that just for this period of time? And Madeline, we've been talking, over the past month, talking about rubber bands and bubble gum, right? We're just trying to patch our way through this. And so if you have that kind of situation where you have one who can do it and one who can't because of this situation, can they do something else? Can you rearrange things? Can you do your best to make accommodations given your workflow and given your workforce and each of their unique and individual situations?
Right, and you could stagger their time. Maybe she could do most of her work in the evening if that, there's different things you can do.
Absolutely. Or you could consider paying for a babysitter to watch those children for her. There's a lot of stuff you can do,
Right.
I mean, what's the cost of a babysitter? Well, probably a lot.
$30 an hour.
But you could hire one of them to watch your children. High schools are out. As long as you know somebody else has been socially distancing and you know them and you respect them, as an agency owner, I would be happy to pay for that child care bill in order to get those hours of productivity back from that employee. I think that that's the wacky thing about this. Not only is each agency's situation different, each employee within that agency's circumstances and situations are different. So it just requires being really flexible in how we're doing it. And I've been thinking nonstop about the comment that you made last week that you had an agency owner who wanted everybody's video camera to be on so that they could drop in and make sure that they had employees that were sitting at their desk and doing their stuff. We should be thinking creatively about how to create a space where folks can work and be productive, but also not take away from them or not add additional stress on them, because we're all stressed. Like, I believe we all have this karmic load of stress on us. And I was asked, Claudia, what do you think the workforce is going to be like in 6 to 12 months? And I'm thinking, man, I can't think past, I need a cup of coffee. Like, that's my horizon now, because it all changes. So I just really, I don't like that question based on the premise that because there are children at home, that person is not productive and should not be allowed to do that and should have to come into the office. I just think it's the wrong approach for this moment in time.
And I think that's the best point there is this is all different. It's like the guy having the camera. He was so used to being able to control the environment, he needed to control it at home too, I'm assuming. So
absolutely. And that's a him thing. It's not a them thing. you know?
That's right. That's right. Good point.
I just want to make one other point on that, Madeline, and that is I've turned into a therapist, not because I want to and not because I'm good at it, but because I've been getting a lot of calls from employers who have, I don't know a better phrase for this, they've just lost it on their employees.
Yes.
A situation happened, they caught an employee, looking at Facebook or something. And meanwhile, these owners are doing everything to keep their agencies alive and employees employed. But then they see an employee maybe goofing off or doing whatever, and they're losing it. I mean, they're losing it. I think people need to realize that we're under this stress, and everybody has it. I have it, you have it. Nobody's stress is different than the others. We all have this existential cosmic burden on us because we cannot plan. We are not in control. We cannot affect our own futures because we don't know what they are. It's a terribly difficult place for all of us, especially all of us control freaks, to be in. But what we need to do is not succumb to that stress, but try to self-soothe, try to self-regulate, and recognize that we have this stress and burden on us, and so do each and every one of the people that we come into contact with, and have that emotional intelligence and that emotional awareness.
I'm currently working on a COVID relief fund for agents funded by insurance companies so we can help them get them back in business, remote work. And the applications, we have over 3,000 applications, and the desperation in those applications has been sort of hard for me to look at. And so I understand the stress the employers are having. I can see that they're very concerned that they're going to lose their business, but really don't take it out on your employees. You need them to service the clients that you do keep. And so it's been eye-opening for me, a little sobering. So
it is, and it creates a hardship. It creates one more piece of emotional brokenheartedness that those of us that have front seats to this have. But don't take it out on your employees. Don't take it out on your children. Now is not a good time to contemplate divorcing your spouse or breaking up with your best friend or your boyfriend. And now is not a good time to start beating ourselves up. Now is the time to treat everybody and ourselves with as much grace and understanding and empathy as we can muster. And we deserve it for ourselves as much as everybody else. Because if we don't give it to ourselves, we will never be able to be there for others.
Yes. And this is a time we've never ever seen in our life, and hope we will never see it again. But
yeah,
let's bring Jennifer back for a question. Jennifer, you want to come back? There she is. Hey.
I would love to give Claudia a question. Claudia, I think you're doing great as a therapist. I'm enjoying your wisdom and your advice on how to get through this with the grace the best we can. Okay, I'm ready for the question we have from our survey box today. Okay, so for employees who are at a higher risk because of medical conditions or because of their age, can I ask them to continue to work from home or at least delay their return back to the office?
Okay, awesome. And Jennifer, I want you to ask me the question about face masks that we were discussing before we went live, because I think that's a really interesting one about being allowed to. So this is a really important question that a lot of folks have. And this is where good intentions and compassion can run afoul with discrimination. So for those employees who are high risk, we want to be able to protect them as much as possible. So offering a reasonable accommodation to them, such as working from home in the middle of a global health pandemic for which we have no immunity, is a reasonable accommodation. It's the right thing to do, and we should definitely be doing that. But you overextend that employee's rights and their rights to not be discriminated against because of their health condition when you go from offering it and encouraging it to making them work from home, asking them to work from home as some form of formal request or directive as a leader of your organization. You need to be very mindful that you keep people's own health conditions private, and that you offer those reasonable accommodations to those that need them, but that you don't make that mandatory, because that would then discriminate against them. I mean, we might think to their benefit, but it's discriminating against them either way. So I strongly encourage that you offer that to your employees to stay home. And I also strongly encourage that you let everybody stay home who can work productively from home. And we made this point last week, and that is that even though we are allowed to open up in many states, and that we're now open for business where we weren't in many locations, that doesn't mean that we should bring employees back into the office when we don't have to, because the threat is still there. It's still completely real. It's entirely around us. We don't have any better immunity or treatment or detection or prevention other than social distancing, washing our hands, and protecting ourselves. So just because you can bring people back into the office, it doesn't mean that you should. And if you are bringing everybody back and you're open for business, it would be discriminatory not to allow those who have health conditions to come back. You need to just offer that to them, and then that choice is theirs.
Sure. So the question about face masks that I asked you about before we went live is sort of inspired from something that I saw in the news. And basically, it was a restaurant owner who told his employees that they were not allowed to wear face masks when they were interacting with customers. And I just wondered, is that something that you can say, preventing your employees from protecting themselves?
So the reason I wanted you to ask me this question in light of the previous question, which was a question about not allowing somebody to come to work, is that the law requires us to allow reasonable accommodations to employees in order for them to maintain their health, not be sick, and work productively despite their health condition, or despite their age or disability or religion, or all of these things. All of the discriminatory protections out there require that employers provide a reasonable accommodation to somebody who needs it because of their protected status. I think providing an employee with and allowing them to wear a face mask is the basic form of reasonable accommodation in this day and age. And in fact, it's almost the only form of reasonable accommodation that we can provide to employees who don't have the luxury of being able to be behind a protective screen, or don't have the, if you're actually interacting as a restaurateur, you have those protections, and you're also dealing with their food. You're dealing with their plates and their utensils. You have exposure that's much different than those of us who are, going to McDonald's and ordering it through drive-through and never actually interacting with somebody. I think that they absolutely should be allowed to provide face masks, and I think there is a legal liability not to allow them to wear those face masks, both in the form of reasonable accommodation and also in the form of liability if that employee does get sick and wanted a reasonable protection and didn't get it. Then I think if I were the attorney for that employer, and I'm nobody's attorney, I'm not an attorney, but if I were an employer's attorney, I would say you're bonkers. You're putting yourself and your employees at risk, legal jeopardy for no reason.
Hope that we start to normalize face masks so that it just is a small level of protection for us all.
It seems like it's becoming politicized, and this is just one of the many things that I discover I don't understand. Like, I just don't understand. That I don't understand.
Yeah,
I did see on Etsy that there's some really, really cool face masks out there. People are making some very unique and different ones. If you want to reflect your personality in your face mask, you can do that.
Exactly. I want to get one of those face masks that has a big, happy, smiley face on it.
All right. So let's see our next question. Thanks, Jen. So my staff is still working, but they're concerned about their 401k plans, and the decline in the market due to COVID-19 related issues. Do they need to change their investments? Do they wait it out? And should we be offering any advice at all to our employees about this?
Well, first of all, I should be offering no advice on this whatsoever because I'm not a financial planner. But I do think, given that we all probably have this same stress and this same concern, it's a perfect time to bring your financial advisors in, whoever is administering your 401k, to come in and have the conversation with your employees. What my financial advisor, and I think what a lot of folks are saying, is in the middle of a free fall in a market, like complete bonkers time that we're having, it's not the time to make a lot of changes. You've already suffered the consequences of the market downturn. You don't want to make any decisions now that would adversely impact your opportunity to ride that boat back up again when it does come up. But again, I think as agency owners, my advice would be, now is a great time for you to remind employees that this is a peace of mind, this is a benefit that they should be caring about, and let's get them the resources they need to know to put their minds at rest so that they're not just worried that they'll never be able to retire. Like, get them in front, get them those resources, get them those financial advisors in to provide those consults virtually, obviously. Let's take one little piece of stress off of those employees. I think it's a great idea. And I don't think, other than providing that resource, I don't recommend to any employer who doesn't know specifically what those funds are, what that exposure is, what's in those portfolios. You don't know, so I wouldn't own it other than providing that resource.
Yeah, we'll get you some help. We'll find somebody to help you understand better.
Exactly. And every employer-sponsored 401k should have a financial advisor to consult employees with their portfolio, makeup, given their age, their likely, their age till retirement, their amount saved already. They should already have that. But if not, find one for them.
And I do know that a lot of plans now have an online portal where you can go in and find out a lot of information about your plan and look at videos and be advised remotely. So
yeah,
it does exist.
Yeah.
So let's see our next question. This is my favorite. It's apparent from Zoom meetings that our remote staff isn't following the agency's drug and alcohol workplace policy. Is there a way to enforce it during work hours while we shelter in place? I think I'll have a little drink.
Yeah, here's just a little nip. I would want to know how the employer knows that. I would want, if you see somebody who's visually impaired, or you can see that they are impaired, they're not visually impaired, you are visually assessing that they are impaired, I would have a conversation with them about it.
Yeah.
I would, if you have an employee assistance program, I would recommend it to your employees to deal with. This is a really funny question, but it underlies a very serious issue, which is, given the cosmic stress we're all under, which we've already talked about, those who had underlying health or substance abuse challenges, or perhaps full-blown addictions, are probably struggling more than most folks realize. Being in isolation, being here under stress, all of those things are tremendous triggers for folks who struggle with substance abuse and addiction. I don't know who hasn't. I mean, folks have either lost weight or gained weight. I think many of us who drink socially and not with addiction are probably over consuming. So if you get the sense that you have employees who are impaired and you assess it and you see it, I would not look at it from the perspective of, what does our policy say about drug use, and following your procedural manual. You're not going to send them off to go and get drug tested in the middle of a global pandemic. But you can look at them with empathy, and you can have that conversation. You can say, I observed, I heard, I noticed slurring of speech or failure to perform, or you just look disheveled, you did not look like you. What is going on? And offer them the resources that they need at a really difficult time. Yeah. And
you would do it one-on-one. You certainly don't admonish them in front of the whole group in the Zoom call.
Oh, goodness gracious, no. Yes. I would have that one-on-one. And actually, if you have a meeting, a Zoom call, and you see this behavior, call it out right there and then, right? You can say, hey, Stacy, please stay on the line. I want to talk with you. And once everybody else is off of that Zoom call and you're sure you've got that private space, that's the perfect time to have the conversation when they are in that state and can explain themselves to you.
Yeah, that makes a lot of sense. Yep. So let's bring Jen back again for a question. And she's still there.
Oh, yeah. Where else would I be? I'm in the house. Okay. So my employee's child's daycare, got that out, is now open, but they are afraid to send them back. Do I have to pay them under the FFCRA?
So there's not a lot of guidance on this yet, and I can anticipate that we are going to get more guidance, because it's not just that now the daycare is open and do they qualify still? It's also, now that the school's over, what were your plans for childcare absence school? So all of those forms that folks filled out about being eligible for 2/3 pay under the Emergency Paid Family Leave Act, we need to revisit those, because those circumstances are now changing. Maybe the daycare is opening up, maybe the school is closed, but what were you going to do in the summer? So all of us need to be looking at those childcare arrangements as they change, as they would normally have changed. So take a look at them. Now, here's the the issue. You're really supposed to establish that the child care's daycare situation changed. That's what that law was providing. It does not provide for you to stay home with your child because you're afraid of getting them exposed. That's not what the law is for. What that benefit is for when that normal child care situation was unavailable to you. So when that child care is now available to you, your choice not to use it isn't really covered under the emergency paid sick or emergency paid family leave. So I think my counsel would be to employers to be very careful about that, because if you continue to provide that paid family leave to those employees and they had daycare available to them, the federal government may not reimburse you for that.
Oh,
So I'm not saying that it's not a bad idea to do it for that employee, but it may no longer qualify to be reimbursed by the federal government, in which case you're now offering a benefit to that employee that maybe you want to do. And again, rubber bands and bubble gum, if that makes sense to that agency and that employee to do that, that's fine. But if they have available daycare to them, and that's on the form that you fill out, you have to provide documentation that you do not any longer have childcare availability because of closure orders. But if those go away, then that's a whole different deal.
That's interesting, yeah. All right, one more question, Jen? Do you have one more for us?
do we have one more? Yes. Now that some states are opening back up for business, can I restrict my staff from traveling to those states until the pandemic subsides? Can you tell your employee not to go to X state, Florida, for vacation? That's off the table.
Yeah, and I don't have an answer for this other than my own opinion. So I haven't seen, there's no can you rule out there? We're winging it on most of this anyway. I have a situation where I have a friend who lives in a state that's opened up, and they're like, come on down. But here's the thing, I'm still in a state that's closed. I'm still in New York. So by my transporting myself down there, am I bringing something to that state, first of all? Because that's really in violation of my order here, which is to stay in and keep my mask on. So I think anybody who's considering travel at this moment in time should follow the rules where they are. That would make the most sense to me. And if they are traveling to locations that do have infections, I would recommend, if they do that they consider self-quarantining when they come back, especially when they have the ability to work remotely. It's not that much of an accommodation. They want to go, fine, go. But when you come back, please protect yourself and protect the other staff around us from that decision that you've made.
I did see this morning that cell phone records were showing that the states that opened up, that people were traveling from all other states to those states. So people are just getting in the car. Hey, North Carolina's open. I'm going. So and that's just going to cause a rise in this. You know, it is.
We don't know. We don't know, and that's the thing is you've got Georgia, which has opened up and has a lot of infections. In fact, last week most of the calls we got were from Georgia, which was opened. So that's one of those things my brain can't figure. I don't understand that. But then in Alabama they had like less than 100 cases. But did they? Because they don't have the testing, and if they're not testing, you don't know. Like we're all flying blind. The best thing we can do is continue to socially distance, wear our protection when we are out and about, wash our hands, and stay as safe as we can until we know where the disease is, we know how to avoid it, and we get some form of vaccine or some form of protection. Until then, we're just all flying blind.
Yeah. So Jen, I see we have a question from the audience.
We do.
Oh, it's a good one too.
Okay. So Ray Williams asks, thank you for the question. What about leftover funds in 125K because you didn't use it for childcare? Thank you for that.
Yeah, thank you for that. I don't even know what to say about that. I really have no idea. I would call your fund administrator and ask them what their advice is for that. Again, I have no idea what they're doing in terms of whether or not they're going to put together some sort of a special rule for rollover in this day and age, or some form of withdraw. They are making, these laws do have comments in them about some of these pension funds. Like you can now take money out of your 401ks for things that are adverse impacts related to COVID. That was included in the CARES Act and in one of the earlier stimulus funding packages. Again, I'm not a financial advisor, so I am in no position to do that. But I would check with your CPA, your accountant, and also your plan administrator to see if there has been some guidance about that. That's a super good question. Unfortunately, I can't answer that.
Yeah, I did see this morning that the federal government is considering allowing the employees to carry more vacation over than they have in the past. And I think a lot of employers will probably go that route because I can't take vacation. I'm accumulating my time. I don't want to lose it all. So.
And that's been actually one of the most prevalent questions we've gotten from businesses that's COVID related, but in the future, like when we get back together, because folks, they haven't taken vacation. They haven't gone down to Florida, thank goodness, yet. Most of them won't. But they want to. And so if you don't have policy allowing folks to roll over their 401k or their PTO, or if you don't pay it, if you don't have rules that make sense in this day and age, given what people can and can't use, make it up. You can make up your special COVID rule for vacation for 2020, 2021. You can donate it into a pool so that you all have access to that if you need it going forward, that you can share. There's lots of, you can allow employees to borrow from the future to put it together. There are lots of different things we can do with PTO. And it is an issue that employees and employers are going to have to deal with because no one's using it. I mean, unless you take PTO to sit in your living room, which sounds like a great idea to me.
Yes, it does to me too. I agree. Do we have any more questions today? Is that the last one?
I think we have reached the end of the questions for today. We had a lot of really good ones, a lot of moving parts. Claudia, how you keep this all together, your mind.
It's not that good. Don't poke any holes in there because there's nothing but air going through.
So before we close up, two things. First of all, we want to see what you're doing with your baking. So
I haven't really done any baking yet, but this is my sourdough starter. This is kind of like a puppy, but Dory would understand that. It needs to be fed twice a day, and it needs to be kept somewhere special, and it like breathes, and then it comes back down again. It's alive, and that's really scary because it started with flour and water a week ago, and now it grows and crawls and does all sorts of things. But eventually, I hope to be able to turn this into bread because I can't get yeast anymore because of COVID. So that's my little project.
That is great. That's very interesting. So before we close up today, tell us a little bit about the special plan that you have for our members for HR consulting, and tell us about your YouTube channel.
Oh, great. Thank you for reminding me. So at Affinity HR Group, we put together a special, I call it a COVID hour, but a discounted hour of consulting for Big I members, for agency owners, which is basically our normal hour of consulting, but it's discounted. And we've structured it so that you can take it in small increments, because what we know about this situation is that you get one exposure, you get one situation. Okay, what do I do with this employee? Well, then you have to talk through, okay, what kind of leave do they require? What kind of decontamination does your office require? What kind of notification to other employees do you have to do? When can they come back? All of those issues comes up with each one of those circumstances. And if you have 2 or 3, again, every situation is different. So we're offering this COVID hour. Please go to our website, which is at affinityhrgroup.com, and you'll see information about this COVID hour. I think, Madeline, you also have it on the Big I site. But I also want to encourage folks to connect with me on LinkedIn. We have an awful lot of resources that we are promoting, that we are sharing when we come across them. It's all free and it's available to you, just to provide resources to a lot of agencies that, you know, the person who's doing HR may not be an HR person. So that we can provide that resource. And our YouTube channel, that's my dog's collar. He's sitting right over there. But our YouTube channel has a lot of pre-recorded and aired webinars on how to open and COVID. We're going to be developing a new one on how to hire and recruit remotely during a pandemic. So please check with Affinity, the Affinity HR Group channel on YouTube, and please connect with me, Claudia St. John, at Affinity, or Claudia St. John on LinkedIn, and that'll get you some information. Thank you for asking, Madeline.
That's great. Well, thank you, Claudia. And well, thank you, Jennifer and Claudia. Today was great. Now, next week, we will not be live with this because it's our Big I's National Legislative Conference. If you're interested in attending the conference, it's free registration. Go to independentagent.com to register. We'd love to have you join us next week. But thank you we'll see you in 2 weeks, Claudia. Thank you so much.
Great. Thank you.
Thanks, Jennifer. I'll see you later.
I'll be in the house.
Yeah, me too.
Bye, everyone.
Bye.